This episode is brought to you by Polestar. There's only one true way to experience the all-electric luxury SUV Polestar 3, and that's to take a test drive. It can go from 0 to 60 in as little as 4.8 seconds with the dynamic handling of a sports car. But to truly understand how it commands the road, you need to be behind the wheel. Up to 350 miles of range, the 3D surround sound system by Bowers & Wilkins. It's all something you have to experience to believe. So book your test drive for Polestar 3 today at polestar.com.
Hello, friends and family. Welcome back to the Sober is Dope podcast. I'm your host, Pop Buchanan. And today I have the privilege of interviewing Dr. David Clarke. Dr. David Clarke is a board-certified internal medicine and gastroenterology specialist, author, and leading expert on stress-related illness and chronic pain. As president of the Association for Treatment for Neuroplastic Symptoms, ATNS, he has helped over 7,000 patients heal from brain-generated symptoms like he has helped over 7,000 patients heal from brain-generated symptoms like fibromyalgia, migraines, and gut disorders linked to trauma and emotional stress. Dr. Clarke is on a mission to bring hope and healing to those left behind by conventional medicine. Addiction is often called a disease of the brain, but what if your chronic pain, fatigue, or gut issues was also brain generated? Today's guest, Dr. David Clarke, explains how unresolved emotional pain, especially from trauma, can turn into real physical symptoms and how we can begin to heal. For anyone in recovery struggling with lingering health issues, this episode might be a game changer. So with no further ado, friends and family, I would like to bring in Dr. David Clarke to the Sober is Dope podcast so we can have a good chat on stress-related illness and pain. Let's go. Hello, friends and family. Welcome to the Sober is Dope podcast. Again, I'm your host, Pop Buchanan, and I have the honor of having David Clarke on our podcast today to talk to us about some beautiful things that we like to talk about, such as neuroplastic symptoms and neuroplasticity, pain, life, and stress. And this all relates to our healing overall in general, whether it's physical, mental, emotional. We are always healing, especially in addiction recovery. So Dr. Clarke, thank you for joining Sober is Dope. How are you today?
I'm just great. Thank you so much for being with you today.
It's an honor. So, Dr. Clarke, I want to get right into it because a little background on me. I'm 12 years sober from alcoholism and alcohol misuse, right? So I created a lot of pain from my behaviors, from blackouts, from falling, from hitting my head, from fights, from the natural damage that alcohol caused to my brain. And on Sober is Dope, I always talk about making positive lifestyle changes to help the brain heal as well as the body, right? Whether it's through neuroplasticity, we always talk about that on the podcast on how certain behaviors can promote healing and actually promote rewiring of the brain. Also, rebuilding our dopamine receptors, which really takes a bad hit from years of abuse from drugs and alcohol. So some of the things you represent I want to talk about is neuroplastic symptoms, which is chronic pain and illness that can generate in the brain due to stress, trauma, or emotional suppression, not from physical injury or disease, right? Another thing you talk about is the role of deep stress and adverse childhood experiences, ACEs, I kind of like that. How early trauma and chronic stress are major contributors to physical symptoms later in life. And then you also go into failures of conventional medicine and neuroplastic recovery therapy. So, and my audience are dealing with ranges of issues from drugs, alcohol, from pain management, from stress, from trauma, childhood trauma that could lead to addiction later in life, unprocessed trauma that they hold in their body. So as an expert, what I would like to do is give you the floor and you could give us an overview of everything that you're about and how your whole system can help people like us in the recovery community. So you can start wherever you would like.
All right. Well, we should start with the core idea here, which is that the sources of addictions and the sources of neuroplastic symptoms are very often one and the same. And let's start with, we should start with the definition of neuroplastic symptoms, which is symptoms, as you mentioned, generated by the brain, but in the body. They're not from organ disease, they're not from structural damage, but they feel like they're from organ disease or structural damage. They're just as severe, they're just as real, they can last just as long. We're talking about migraines or dizziness or visual problems, difficulty swallowing, pain in the TMJ joint in the jaw, fibromyalgia, irritable bowel, bladder spasms, pelvic pain in women, spine pain is a huge one, chronic fatigue, long COVID, joint pain, certain kinds of rashes, brain fog, uh, chronic fatigue, if I didn't mention it, they're just the only common denominator is that people tend to have more than one of these at the same time. And they can go on for years. They can be incredibly severe. I've had many patients in the hospital. My first book, which is called They Can't Find Anything Wrong, the very first story I told was a patient who was hospitalized at a prestigious university 60 times with no diagnosis. They had no idea why she was having attacks of severe dizziness and vomiting. It was all brain generated. And why was the brain doing this? Well, it's neuroanatomically different. There are different nerve pathways going on in people with this condition. And why do those pathways happen? Well, it's because of stress, as you mentioned, trauma, repressed emotions, sometimes other life challenges that can happen to anybody. People who have this condition are not mentally weak. They are just coping with enormous amounts of pressure or stress from the present day or sometimes from the past, the ACEs, the adverse childhood experiences. The way all this connects to addictions is that the same kinds of stresses, if people are not consciously aware of where they're coming from or not consciously aware of the magnitude of what they're having to cope with, sometimes the only recourse that they have to try to survive, to try to deal with the amount of pressure and stress that they're experiencing, is to fall into one or more different kinds of addictions, which can be to alcohol or to drugs or to some other kind of substance, but it can also be to behaviors, to being addicted to almost anything that is harmful to you. So it can be work, it can be sex, gambling, exercise, shopping sometimes, pornography, the internet, um, a whole long list of things that your brain just draws you into as a coping mechanism, that you're dealing with some kind of pressure or stress or issue from the past or present, and you're not fully aware of where all that's coming from, and so you're just experiencing the sharp end of the stick from that, and you're looking for a way to deal with it. And substances and other forms of addiction, and eating disorders in some cases, and cutting behavior for some people, these are all just ways to cope. And the common denominator between my work with people who are physically ill and your work with people who have an addiction is to go back and find the source. Because typically it's a common source. Many of my patients with addictions and neuroplastic pain at the same time have had those at the same time, or they've had an addiction in the past, and they're still dealing with the neuroplastic symptoms in the present day. And when I'm talking to them about their lives, we see the issues from the past that are the source of both of these problems.
Wow. Um, when you say issues from the past and neuroplastic symptoms, are we talking about how the pain and trauma kind of like damages the neurons and how they connect so they don't fire or wire together or some, is that the theme of the problem with the, like, what happens with the neurons that create these symptoms? Like, what goes wrong? How does the stress causes the dysfunction in the normal neural pathways?
Yeah, the stress is associated with changes. There are magnetic resonance imaging studies of the brain that show that the circuits in the brain that deal with internal signals coming from the body are actually getting processed in a different way in people who have had a trauma or a stress or a repressed emotion than they are in people who don't have neuroplastic symptoms. And we've even got now studies that show that with neuroplastic recovery therapies, which is a new form of psychology that is specifically designed to treat symptoms in the body, that those pathways in the brain can physically change. So we're not talking about symptoms that are imaginary. We're not talking about symptoms that are quote unquote in people's heads. We're talking about symptoms that have a real physical basis. It just happens to be in the brain rather than in the body. And when we are treating this, when we are identifying the underlying causes and treating those successfully, people get better and their brains physically change.
I love that. So in on the podcast and in general in my life, I always talk to about how if we heal the root causes of our pain. So let me kind of reverse that in a bit. Like I we try to identify for people most addictions stem from some form of trauma or grief or loss. And we kind of batch these things together. So for example, if I go through a divorce and find out my wife was like, for example, or my wife was cheating on me and then she leaves me for a beautiful $1 million guy and I gotta watch them drive off the sunset on a Ferrari all day and I'm depressed and I'm drinking and I'm wallowing in my pain, that could change my brain. The grief intrinsically can change my brain in a way that caused me to have a different type of behavior in response to the world, lean more on alcohol, and thus develop an addiction. So we see people who are normal, never had an addiction a day in their life, and maybe someone dies, they lose a big job, they go through a major loss, and now they use the alcohol to cope. Something happens to their brain, and then now they're staunch, dead set addicts, and now they're off to the races, and their pain is what's driving it. So then we say, okay, if you go to something like Alcoholic Anonymous or rehab or just to treat the actual addiction, how do we treat the underlying root cause of the pain? Because if not, you're most likely going to relapse. So we have to go back to the source of the trauma and the pain. If it's the wife, let's see what we got to do. Let's try to make amends. Let's try to get over it. Let's go to therapy. Let's practice radical forgiveness. So that's kind of some of the themes without me taking like a, it's not technically like neuroplastic recovery therapy, but it was kind of like this unsung kind of unspoken rule that you kind of start to feel when you're really in the midst of healing and your recovery. You start to realize, wait a minute, what about what caused it? Like if I don't go back to deal with my childhood trauma, if I don't address my sadness and loss and my pain, how can I heal? And sometimes when you do that, people have long lasting, like I'm 12 years sober because I immediately dealt with the death of my father, and I identified that as one of the things that led me to my addiction. I never got over it. I never sat with a counselor. I never went to bereavement counseling. And then you compound that with losses over the years, whether it's through a job, then you compound that with a bad breakup, and then you're drinking. Next thing you know, you develop this kind of a monster. So I say all of that to bring us back to how important it is and what do you recommend for someone to identify these sources of pain, traumas, and these mechanisms in the brain that leads to these neuroplastic symptoms? What can someone do to start to heal in that way and identify this trauma? Because some people don't even know where it comes from.
Absolutely right. The None of us has a parallel life that we can compare ourselves with. So when we look back, we don't necessarily see the magnitude of the burdens we've been asked to carry. I 100% agree with everything you just said. In fact, you're making my job easier by sharing all this with your audience because it's absolutely true. But what a lot of my patients remind me of is Olympic weightlifters who are being asked to carry 50 pounds more than the world record for their weight class. You know, anybody who's trying to do that is going to feel that burden, is going to feel that pain, but they won't necessarily know how much they're carrying because, they just uh, experienced it and they have no alternative universe that they can look at where they didn't experience it. So it can be hard to see it when you're looking back. It can be hard to appreciate the magnitude. And this is exactly what you experienced. Your father died, and it had a major impact. But you were not, at least initially, consciously aware of just how big an impact it might have had. I spoke with someone recently whose mother committed suicide when he was 9 years old. And that was something that obviously hit him really hard, but he didn't appreciate the magnitude of it right away because he was 9. And it's just something that terrible that happened to him, and he knew it was terrible, but he didn't know how terrible, and he didn't know um, how long he carried that burden and the nature of that burden. So a lot of my work is to help people understand um, how much they went through as kids, get an appreciation for the magnitude of that weight that they're carrying on their shoulders. And that has a couple of beneficial effects that we can get into. But one of the techniques that I use over and over again, because it's very powerful, is to ask people to imagine a child of their own or some other child that they care about a lot, and imagine that kid is in the same environment they were in when they were growing up, and they're not able to intervene. My patient has to imagine themselves as a butterfly on the wall of their childhood home, and they're watching this kid that they care about try to cope with everything that's going on in that home. And when people do that, they get a completely different perspective of how much they had to deal with. Because, when they look at their own life, they're saying, oh, it wasn't that bad. Other people have been through worse than me. I think I'm over it now. But when they think about their own kid trying to deal with the same stuff, you see their facial expression change, and they get really thoughtful or sometimes horrified at the idea that their own child would have to deal with all that. And that the purpose of this exercise is not to re-traumatize people. It's to help them see the reality of how much they had to go through, and from there to appreciate the heroic perseverance that they must have had to come through something like what they went through. And when you can appreciate yourself more, it's a foundation for healing. Let's put it that way. When you can look at yourself not as somebody who was a failure or somebody who was mistreated, you can look at yourself as somebody who got parachuted into a dangerous jungle um, as a toddler, for example, and had to find their way out of that situation. They're in there. They're in that jungle through no fault of their own, but they deserve tremendous credit for having made their way out of it, and internalizing that belief in themselves as a strong person goes a long way toward reducing the stress level. So many of my patients um, were uh, given the assumption early on that they were second-rate human beings, that they were no good, that they were worthless, because of the way they were treated or the experiences they had to go through. And if we can flip that, if we can help people understand, no, that's not true at all. That's a lie. That's a false assumption. You actually did a remarkable job coming through what you had to come through. And that just, it helps people to take that weight I was talking about and begin to put that down. And then the need for the addiction begins to fade.
Amazing. Wow, this is good. This is good. In the last this is a major development in everything that we do on every front, on psychologically, in psychotherapy, just emotionally, everything you're doing is really important. I just want to tell you that it's really exciting to track this work. I studied Dr. Gabor Mate on how he talks about some of these themes of repressive pain and trauma, and The Body Keeps the Score, that popular book, things like that, where unprocessed emotions get stuck in the body. Also, harboring shame and guilt. A lot of people harbor shame and guilt in relationship to their past for various reasons. And like you talk about that, the repressed emotions, how that kind of manifests into ugly things within inside of us later on. So this is really exciting. All right, so I want to ask you a personal question. I was recently, within the last 3 years, diagnosed with something called multiple chemical sensitivity or hyperosmia. So I don't know if this was in relationship to long COVID. I don't know what caused this, but I know during COVID, I never was tested positive for COVID, but I had a terrible fever for about 3 weeks. When I came out of that fever, which was a stressful event for me, when I came out of it, I couldn't process any scent, any strong scent, anything above a bar of Jergens or Ivory soap will shut me down. So I can't have air fresheners in my house. I can't deal with detergents. I can't deal with barbecue sauce. I can't. My whole life changed. They cannot figure out. They can't. They saying there's no cure. They can't figure it out. And in deep within inside of me, I feel like this has to be somehow brain generated from maybe the culmination of all the stresses, or maybe the culmination of being almost dying for having a fever for 4 weeks, being in that dark room by myself, scared to go to the hospital. Something when I came out, I was a different person. Now, for something like that, for people who have these weird autoimmune things that kind of come out of nowhere, how does that relate to neuroplastic symptoms, or is that in the realm of it? Is it,
Oh,
am I,
yes, absolutely.
okay,
Yeah. Anytime you have a symptom, a pain or an illness or a condition like that's diagnosed as multiple chemical sensitivity that doesn't have definitive medical diagnosis, that we're not nailing this diagnosis to the wall with an X-ray or a blood test. We're not showing a particular organ that's diseased or a structure that's damaged. Then the neuroplastic explanation becomes part of the discussion, let's put it that way. And that's when I'm starting to look for what kinds of stresses are going on in a person's life right now, what kind of stresses might have been going on in the past. You mentioned those emotions. Those can be difficult to recognize in a person because they can be so deeply buried or repressed that people are not consciously aware of them. My patient who was admitted to the prestigious university 60 times in 15 years, she had a tremendous amount of anger at her abusive mother, but she was not aware of it. And all of her attacks of illness were connected to interacting with her mother, either directly or indirectly. But she couldn't see it because she didn't recognize the depth of the emotion that was going on there. But emotions are only one potential cause. There's lots of other kinds of stresses that can do this, but multiple chemical sensitivity is one that is frequently neuroplastic, let's put it that way. And so I would be looking for past and present sources of stress, anything that's triggering, anything that perhaps the near-death experience of being in a room with a fever for 4 weeks might have triggered for you. Triggers are another a big one that I look for. That's something that's happening to you in the present day that is highly stressful because it reminds you of something that happened in the past. Maybe you had a near-death experience in the past, for example, and being so ill for so long could have brought some of that fear back. Into your life and generated the stress sufficient to change the nerve pathways and then resulting in what are real physical symptoms. So yeah, absolutely likely to be a type of neuroplastic symptom.
thank you for that. So that'll give me some hope, because I'm working with as many researchers as I can to try to be on the front line to help people. Because it's like I'm pretty lucky to have kind of this knowledge base to kind of like navigate this. But there's hundreds of. I posted one video on YouTube, and there's thousands of people that's just like this change. It happened to me. I don't know what to do. I don't know where to start, and it's really discouraging for some people, even to the point where it's a story of a lady who was a powerful attorney. She developed MCS, and now she lives in a tent in a park because there
Oh,
was no other resource for her. Like, she just can't tolerate. Like, she has an extreme version of what I have, and it's just that she just has to. It's on YouTube. It's an old story. This was even before MCS. This goes back almost 12, 15 years. You can see the whole news or the whole story is sad. that people go to these extremes just to find peace. You know, I always have a joke that I'm gonna go to the Amazon to get away from scents, and I'm gonna run into some form of gorilla with some cologne on. He's gonna have somebody had a lead over there. He's gonna be like, I can't go nowhere. It's no escape. But move it along, Doc. So, all right. So, can we talk about pain management for people in the addiction community that they have these physical symptoms and they have to take these medications, but now doctors, because of the opioid crisis, they can't prescribe them like they used to. So now people need alternative ways to deal with real pain. Is there any part of that world that could be neuroplastic related, or is this kind of field of study, can it be like the beginning origins of maybe helping someone who's in chronic pain that's reliant on opioids or painkillers to cope?
Yeah, this whole approach offers real hope for people with chronic pain. Now, the approach doesn't apply to somebody who's got pain from an infection or a tumor or inflammation, where we can see actual damage to organs and structures. That isn't neuroplastic pain, and so the neuroplastic recovery therapies are not appropriate for that. But a very large fraction, probably a majority of chronic pain is neuroplastic, and these approaches do apply. If you're already taking opioids, I wouldn't change the dose. I would start with an assessment for a person's past and present stresses. Find out, what's been going on in their life here lately and also in the past. Start working with those issues and see if we can make some progress. And if we do, then we can start to taper down on the opioid doses. If somebody is dealing with chronic pain without the opioids, they're already off them or they never started them, then the situation is easier. We can start working on the stresses, start bringing the impact of those down, and usually we start to see a response in the person's pain or illness symptoms. And when we see that, people are encouraged that we're on the right track, and that if we keep going, we're going to make progress. I've had patients with, one, 17-year-old, I remember, I was asked to see in the hospital on her 70th day. She was getting morphine around the clock in large doses for unexplained abdominal pain. She'd already seen 6 other specialists like myself. But it turned out that she had a big stress in her life that nobody had found out about before. We had a conversation around that. We made some changes in her family to reduce that. And she started tapering her own morphine down the next day.
Wow,
She
that's
was
it.
onto pills. It was intravenous morphine, 250 milligrams a day for people who are familiar with the doses. 10 milligrams would have been enough to alleviate the pain of a fractured leg. She was getting that every hour.
Oh my God.
She started tapering it down. She was able to transition to tablets after a week, so that meant she could go home from the hospital. 30 days after we met, no more opioids of any kind.
Amazing. That's beautiful. Wow, that's a lot of hope, Doc. That's hope out there. Oh man, wow. Congratulations to her. That's beautiful. That really warms my heart. I have a lot of friends in this field, and I'm happy that they're developing modalities like this that can help them. Something came to the top of mind. Cortisol. Is this are neuroplastic symptoms from elevated cortisol levels, or is that kind of like the theme? Are you reducing cortisol and or neurotransmitter hormones like maybe adrenaline, norepinephrine, serotonin? How does the neurotransmitters work, and how does cortisol relate into this whole conversation?
Yeah, cortisol and adrenaline, those tend to be more what we call acute hormonal changes. They go up in response to an injury or a stress that is happening in the short term. If you've got symptoms for a longer term, 2, 3 months or longer, then those tend not to be playing as much of a role. What the studies have shown, there's one particular from, I believe, Northwestern, that when you've got an acute pain, let's say, you're lifting something you shouldn't lift and you throw your back out, and you've got sudden onset of pain, that lights up a particular area of the brain. If though the pain goes on and on for 2-3 months or longer, the part of the brain that is active changes. It goes from the acute pain part of the brain over to a different part that's, um, let's just say, more psychological in nature. And so the all the acute stress hormones tend to be less important at that point, and it's more about the changes in the circuits, the neuroanatomy that is responsible.
Wow, Doc. All right. So as we wind down, this has been very informative, and I swear we're gonna do more. I want to bring you on more as the science develops, and just stay in touch with you because I'm really impressed, Doc. This is amazing stuff.
Thank
Can
you.
you give our audience a quick overview on what exactly is neuroplastic recovery therapy, and if they wanted to see you, what can they expect as some aspects of treatment? And yeah, I would like to hear about that. And then you could tell everyone where they could find you, where how they could reach out to you for treatment. And we're really excited to hear more.
Yeah, you bet. The website of my nonprofit is symptomatic.me, and the first place to go there is a 12-question self-assessment quiz. People who are wondering if any of this might apply to them, they can answer those 12 questions, and by the time they get to the end, they'll have a pretty good idea if these concepts apply to them personally. I'm not in practice any longer myself. I retired and closed my practice in order to teach full time and to run the nonprofit. But we've got a whole directory of practitioners, a couple of hundred of them around the country and around the world, that have taken special training to be able to use these new techniques. And the new techniques are incredibly powerful. The old cognitive behavioral therapy, the statistic we look at is called effect size, which is the effect on a group of patients or an individual patient. And the number we used to see with cognitive behavioral therapy in people with chronic pain was zero point 0.3 or zero point 0.4 at the best. The new techniques, it's upwards of 1.5 on the effect size. So roughly 4 times as powerful. Veterans Administration study out of UCLA showed the same thing. They were trying to get people to get their pain about 30% better, 1 out of 3 better on their pain scores. And with the new kind of therapy, they got 67% of them. And these were older male veterans, very tough group. They're not going to um, be accepting of any psychobabble. You really got to talk to them where they live. And they got 67% of them to reach that pain relief goal, whereas the older cognitive behavioral therapy was only, I think, 17%. So once again, about a 4-to-1 ratio of success. So what's different about the new forms of treatment? Number one is their goal is to alleviate your pain. We're not just trying to help you live with it. We are trying to make it go away. Now, it applies to people with neuroplastic pain. We're not talking about people with pain from organ inflammation or infection or fractures, that kind of thing. That's not what we're about. We're about neuroplastic pain. And that's the first step. We're going to try to alleviate it. Second is we want to shift your attention away from where the pain is, which is naturally where your attention is going to want to go. If you're hurting in your back, that's what you're going to be thinking about. But if your back isn't the problem, we want to shift to thinking about, well, what's going on in your brain? What kinds of stresses do you have that might be responsible for this, either in the past or the present? In the present, it can be something very simple. One of my patients, he only got his pain when he was driving to work.
Wow,
When he was driving home from work,
that's
no
amazing.
problem. Same on the weekends when he was not at work. Other people, it's the ACEs, the adverse childhood experiences, which can be obvious as in terms of abuse or violence in the home or somebody with an addiction problem in the home, but it can be more subtle than that. It can be anything that makes a child feel like a second-rate human being. Um, One of my patients, the only time he got praise from his parents was when he did something better than his brothers and sisters could do it. And his brothers and sisters were, very talented people. So
Okay.
he ended up growing up feeling like a failure, and that had impacts on him well into his adult years. So that's the second step, is to, first get your attention off of your pain and thinking about what's happening in your mind, then thinking about where the stresses are, past and present, and what impact they might have had on you. And then we get into there are books about this for self-help on our website, symptomatic.me. There are videos. There are question and answer sessions that we have with experts every month. We've got various treatment programs on the website. We have evidence-based self-help books for people, lots of resources on there, plus the practitioner directory with a couple of hundred people that know how to practice in this field.
Oh man, Dr. Clarke, thank you for joining Sober is Dope. This is an amazing episode. We'll put your website in the show notes, and I love the name. I love everything you're doing. I'm really impressed today. I'm happy I met you, and thank you so much for joining us. All right, so you listen to the Sober is Dope podcast. That's a wrap for our amazing episode with Dr. David Clarke. And we are extremely excited. I love you all. And remember, if you are struggling with pain, whether it's through addiction or through life, there is hope. There is hope. And never give up. Love you all, and we'll catch you all on the other side. Peace and love.